Namaskar. I am Dr. Mandana Joshi, interventional and neuroradiologist from Yashoda Hospital, Secunderabad. In Yashoda Hospital, we have advanced minimally invasive surgical procedures available in the Department of Intervention Radiology, which are done actually in a non-surgical way through a small pinhole in the body, in the skin, mainly done for the blood vessels of the body. So we will talk about that today. These are the procedures done for almost any part of the body through a minimally invasive way, through a small hole in the skin, without any big cut, without any sutures usually, through a small hole in the body. The treatment can be done for many parts of the body, many organs of the body. For example, you must have heard about the disease called as stroke. Stroke is a deadly lethal disease. It can cause a loss of life, it can cause a paralysis, it can cause a complete vegetative condition of the body. What happens in the stroke is that there happens a block in the blood vessels of the brain. When the blood vessels of the brain blocks, the brain tissue starts dying and that part of the brain becomes incapacitated. Because of that, what happens, that person may have a paralysis, it can go into coma. If I tell you particular signs which people can recognize, people may have a loss of balance while walking, suddenly they may lose the balance of walking, suddenly they may have difficulty in seeing, suddenly they may have a facial drooping, the face can go on one side, they may have a difficulty in talking, in speaking, and they may have a difficulty in any other part of the functional of the body. So the stroke is one of the very lethal disease in the body, and because it happens from the block in the brain blood vessel, if the brain blood vessel block can be opened, the tissue can be saved in the brain and the person's life can be saved and the incapacitating condition can be prevented. In that, what is done is that intervention radiologist can go into the brain blood vessel through a small hole in the leg or arm blood vessel and can go and take out the clot which is blocking the brain blood vessel. Sometimes it may need an angioplasty and stenting to open the brain blood vessel as well. But the brain tissue can be saved and the person's life can be saved if the person arrives in time. But remember, this is an emergency. Person need to reach the hospital as early as possible. If you see any sign of stroke in a person, do not delay, take the person to the hospital as early as possible. Another example, if I tell you, there can be some bleedings in the brain sometimes. That bleeding happens because of the weak point in the brain blood vessel. There can be some bulging in the brain blood vessel, which is called as aneurysm. The size of prostate can be reduced by blocking the blood supply in the prostate. So that is a procedure called as prostatic artery embolization, where the size of prostate can be reduced without the surgery and a person's symptoms can miraculously improve many times. So these are the treatment done with the help of intervention radiology. In Yashoda Hospital, we have an advanced state-of-art biplane cath lab available through which all these treatments are done in a very, very minimally invasive way. Thank you.